Okay, we are, well, welcome to class. We're going to take a look today at the axial skeleton. This was the, excuse me, the second part of the bone review we're doing. Last time we took a look at the skull, and today we'll do the axial skeleton. Next week we'll do the appendicular skeleton and the various joints that it makes up. So, anybody have any questions on anything before I start? No. The lab exam grade should show up as soon as you take it. It should be under, the lab exam should be under assessments. Go into the eLearn content, go to assessments, and then go to quizzes. And it should be there. It better be, because I put it in the other day. So, and it should have opened up this morning at 12:01. So, not that anybody needed to be awake at 12:01, but it should be there, and it should grade it, give you your grade as soon as you take it. If it didn't do that, then let me know, and I can I'll fix that. So, because sometimes eLearn does throw me a bit of a curve here, but I will check to make sure it's there, and I will also make sure that it will give you your grade too. So, any other questions? Okay, great. Well, those actually were great questions. Sometimes I just assume everything worked, and I don't know until I find out later that it didn't. So, okay, let's go into the axial skeleton. And here we go. And okay. So the axial skeleton is everything in our skeleton that runs in a vertical axis. So it does not include the arms and legs or the hands and feet or fingers and toes. It does not include the skull. What it will include is going to be the sternum here. It will include the ribs and the vertebrae, cervical vertebrae, the thoracic vertebrae, excuse me, the lumbar vertebrae, as well as the sacral vertebrae and the coccyx. So there's our ribs. Behind we have the cervical vertebrae here, and then directly underneath that we have 12 thoracic vertebrae and 5 or so lumbar vertebrae down here, these very large ones, followed by the sacrum and the coccyx. So, within separating the vertebrae are a structure called the intervertebral disc. The intervertebral disc is made up of fibrocartilage. It's the other type of cartilage. It's not hyaline cartilage. And we use this for cushioning between the bone, the vertebrae. We use this for cushioning at the pubic symphysis, where the two hip bones come together in the front. So it functions as a great shock absorber for our bodies. It absorbs the shock of motion as we walk and run and do things. And of course, there's one of the lumbar vertebrae. The thoracic vertebrae, you can always tell where they start and stop. They start at the ribs and they stop at the ribs. So thoracic vertebrae 1 starts at the first rib, and thoracic vertebrae 12 is at the last rib. There are 12 sets of ribs, and there are 12 thoracic vertebrae. So here we see the ribs. There are 12 pairs of ribs. The first 7 are called the true ribs. The first 7 attach directly to the vertebrae in the back and to the sternum, the breastbone in the front. Now they do connect using hyaline cartilage, but they connect directly. You'll notice that the ribs are highlighted in red, and the first 7 ribs are highlighted in red, and they have a white band at the end. That is the hyaline cartilage, but they are connecting directly to the sternum. In the back, those first 7 ribs attach directly to the vertebrae. We call them the true ribs. Now below them, we have 3 pairs of false ribs. The false ribs attach in the back to the vertebrae, but in the front, they don't attach directly to the sternum. They attach indirectly. Each one of those false ribs, you'll notice when it goes around here, let me see if I can get it to, you'll notice on each one of those false ribs, and that would be 8, 9, and 10, 8, 9, and 10, that they attach to cartilage here. So all 3 of them attach indirectly. They attach the cartilage, the hyaline cartilage at the end of the false ribs attaches to the cartilage here for rib number 7, true rib number 7. So they're attaching indirectly to the sternum. They don't attach directly. They attach to the cartilage, which attaches to the sternum for number 7. So 8, 9, and 10 are the false ribs. And you'll see as it goes around, you can see where 8, 9, and 10 are located and how they don't attach directly to the sternum. They attach indirectly. And then directly underneath them are the last 2 pairs of ribs. These are the floating ribs. The floating ribs attach to the thoracic vertebrae in the back, vertebrae 11 and vertebrae 12, thoracic vertebrae 11 and 12, or T11 and T12, but they don't attach to the sternum in the front. So we call them the floating ribs. So there's 12 pairs altogether. They protect the organs in the thoracic cavity, the heart, the 2 lungs, the great vessels, the digestive tract, the esophagus, as well as the trachea, the airway. So you have a great deal of protection for those organs, not as good as what the brain and spinal cord get, but still very good protection, more than anything else in the body. The viscera below the diaphragm get nothing. So we still have pretty good protection here. So these are the 12 sets of ribs that we have. 7 true, 8, 9, and 10, 3 pairs are false, and then 11 and 12 are the floaters. Now, when they attach directly or indirectly, well, I guess directly matters. You can really see it here in this illustration. You can see you can see right here where this is rib number 7, right here, 7, 6. Yeah, this is rib number 7, and you can see how this is, yeah, how this attach. Did I have that right? No, 1, 2, 3, 4, 5, 6, 7. I counted wrong. And this is rib number 7 here. You can see how the cartilage from 7, 8, and 9, I mean from 8, 9, and 10 are coming up here and attaching. So anyway, but 1 through 7 attach to the sternum. The sternum, however, has 3 parts to it. This first part in green, this teal part, and this purple part. This is called the Manubrium here. This is called the body, and this is called the Zyphoid Process. Let me clear all this off and I'll show you now. Okay, so what do we have here? We have the sternum, the Manubrium. The Manubrium is the top portion of the sternum. The manubrium articulates with the first rib and with the first pair of ribs and with the clavicle. The clavicle articulates here and here at the top. The clavicle will, which is our shoulder blade, the clavicle will articulate up here. And you'll see the clavicle will be in here and in here. So the clavicle there and there. Now there's a notch here too, and that's called the jugular notch. The jugular notch is where the jugular veins that we talked about last week about the jugular foramen, you know, the passage of those large veins down from the head, down from the brain, on their way down towards the heart. Well, they have to pass behind that little, behind the sternum to get to the heart. And they do that at that notch that we see. So there's the manubrium. The body of the sternum, the center portion there that you can feel, you can put your hand on your chest and rub it up and down right in the center line, and you're going to touch the body of the sternum. And down here is what's called the Zyphoid process. Now, the Zyphoid process, this little purple tip that you see over on the illustration, Zyphoid process is a great landmark. The Zyphoid process is at the end of the sternum, and directly underneath the Zyphoid process is the edge of the diaphragm. If you've ever taken a class in CPR, you know that the Zyphoid process is a good landmark for your hands. You're usually about 2 fingers width up from the Zyphoid process with the heel of your hand on the body of the sternum. Because if you compress the chest at the Zyphoid process, you're going to press that Zyphoid process tip into the liver, and you're going to lacerate the liver, which is never a good thing to do. And so we find that as a good landmark for, you know, in CPR training. Also, it's a great landmark to tell you where your diaphragm is, because if you come up and you can feel your Zyphoid process, and we can usually all feel that the pointy end of our sternum, we know that the diaphragm is directly underneath that, and it runs around on either side of the Zyphoid process, following the shape of our rib cage. So this is a great landmark to know where your diaphragm is, where your ribs end here on our anterior surface. Okay, now there is the jugular notch. As I said, the jugular veins will pass down behind that on their way to join the great veins leading into the heart, the superior vena cava, for example. So we have the jugular notch, the manubrium, and we're going to have one more notch here, and that's called the clavicular notch. The clavicle, our collarbone, is going to articulate right there, and that is the clavicular notch is located here and here, because this is the clavicle there, or otherwise known as our collarbone. And it articulates in that sort of that flat edge right here and right there. Clavicle is an interesting bone for us. It does a lot more than we think it does. It helps to make the joint at the shoulder. The ability, the great flexibility that we have in our shoulder joint to move our arm in almost a full 360-degree rotation is because of the junction of the clavicle and the scapula, our shoulder blade. So, and a lot of the flexibility of our rib cage, the thoracic cage itself, is due to the clavicle articulating on the sternum and on the scapula, the shoulder blade. Okay, yeah. So here we see our vertebrae from the dorsal surface. We're looking at the back side of the skeleton here. And we can see a couple of the structures I mentioned earlier. Here is the clavicle here. this is our scapula, our shoulder blade there, and the clavicle is articulating on the clavicle, the clavicle is articulating on the shoulder blade here, but also on the sternum in the front on both sides. Now let's take a look at some of these vertebrae. The first 12 or so vertebrae are called the cervical vertebrae. We start out with cervical vertebrae 1 and 2. These are probably the most important they are the most important of the cervical vertebrae, because cervical vertebrae number 1 supports the head. The occipital condyles that we saw last week, those bumps, those large protrusions on either side of the vertebral foramen. The occipital condyles rest on cervical vertebrae number 1. And this is nice, you can see it here. This is C1 right here, and the occipital condyles are going to rest right in this area there. And so that is that particular bone is called the atlas, A-T-L-A-S, atlas. More on that here in a second. Let me get out of this and move on. So there's cervical vertebrae. There are the thoracic vertebrae. There are 12 of those, and these vertebrae start. These vertebrae start with the first rib, and they end with the last rib. So there are 12 of these, and all the ribs do attach in the back. There are facets on the ribs and on the vertebrae that allow the ribs to attach. Now, they don't all attach directly in the front. In fact, the last two, as I said, the floating ribs don't attach at all, but in the back, they all attach. Directly below the thoracic vertebrae, we have the lumbar vertebrae, probably 5 lumbar vertebrae, very large, very strong, very obvious what they are. And I don't ask you to tell me which ones are which laying out. Even if we were on the ground, I wouldn't ask you that, because you can't look at lumbar 1 and compare it to thoracic 12 and make a distinction which is which, because they look the same. Just like the last of the cervical and the first of the thoracic would look very much the same. So it's very, very hard to distinguish the two when they're that close to each other. So if, I would ask you, in a situation like this, I would ask you what section of vertebrae, like I would have an arrow pointing to the cervical vertebrae, say, what are these? And not individually. The only ones that I will ask you to know by name are these first two, cervical vertebrae 1 and 2. Okay, there's the lumbar vertebrae. Now, there's a large cluster of fused vertebrae. In fact, there are 5 fused vertebrae in this structure at the base of the spinal column, and it's called the sacrum, right there. 5 fused vertebrae. And directly below the sacrum is another structure known as the coccyx, or tailbone. Let's see if I can move this out of the way. I can't get that one to move. Okay. The coccyx is this little bone, tailbone here, made of 3 more fused vertebrae. So they count. They are all part of the spinal column for us. Sacrum and coccyx, or tailbone. Coccyx is sort of an interesting structure because it, all these bones are points of attachment for muscles. So it's not like they're useless or anything like that. The coccyx is so small and fragile, it is frequently broken when someone falls and lands on the base of their spinal column, and lands on their butt hard. It can also be broken during childbirth when the mother is bearing down to push. The muscles that surround the coccyx can easily snap it, and it breaks. And then because it's immobilized by the muscles anyway, it grows back together. And it's a very common occurrence if the mother is pushing hard and it's a large baby. So, okay, there's the sacrum. It consists of 5 vertebrae fused together. You can see these ridges here sticking up. These are called the spinous process. And there are openings here on the sides. These are what are known as the intervertebral foramens. Those are openings for the various spinal nerves. And of course, down here at the end is the 3-bone fused coccyx. And there's the coccyx right there. And this one does, you have a good example here also. All these openings in the sacrum that you don't see in the coccyx. These openings are the intervertebral foramen, the passageway of the spinal nerves. There are spinal nerves coming in from both sides and going out on both sides. There's a pair of spinal nerves at the same level on each side. So there's about 35 or so spinal nerves coming in and going out, and they pass into the spinal cord through these openings here. Now the spinal cord isn't down as far down as the sacrum. So these nerves will come in and go up to the spinal cord. Okay, so here's our vertebrae. We can see cervical, thoracic, lumbar, sacrum. The coccyx is broken off this particular illustration. As I said, it was very fragile, and we see it gets broken on these models all the time. We have lots of models where the coccyx is laying at the bottom of the bin where it got snapped off. So cervical vertebrae, thoracic vertebrae, lumbar vertebrae, and the sacrum there, and no coccyx. So, okay. Close up, this is a close up now of the thoracic vertebrae. As I said, there are 12 of those. They line up with the same number, with an equal number of ribs. And we see the thoracic vertebrae matched up with the ribs. There's a facet on each thoracic vertebrae for the rib, and there's a facet on the rib for each vertebrae. Okay. Rib. And of course, there's our thoracic vertebrae. They extend down pretty far here. And again, the size of T12, the 12th thoracic vertebrae, is very similar in size to the first lumbar. And it would be very hard to distinguish them apart based on size. As I said, the same thing applies to the last of the cervical and the first of the thoracic. They're very similar in size, shape, and appearance, and it's very hard to differentiate the two, which is why I just asked you to know them in clusters. Okay, now this is not a fish or a snake or a lizard. This is our vertebrae put together without the intervertebral discs in between. What this does show, we don't have any pads in here, but what this structure does show are these openings, these little openings that show up here. These little openings are called the intervertebral foramens, or foramina, since there's lots of them. These structures are where the spinal nerves go into and out of the spinal cord. They're formed by the nesting of the vertebrae, because the opening doesn't really exist until the vertebrae are pushed together. So the vertebrae come together. We don't have an opening. The opening is formed from the top portion of one vertebrae and the bottom portion of the vertebrae in front of it. And they come together to form the opening. But the intervertebral foramen is where the spinal nerves are going to go into and come out of the spinal cord. Since the spinal cord is part of the central nervous system, the nerves are part of what we call the peripheral nervous system, and they control the arms and legs and hands and feet and glands and all sorts of other things here, bringing instructions out to the muscles, for example, or bringing information into the spinal cord and brain, because we have both a motor output telling us what to do and a sensory input telling us what's happening. Okay. Now, those same intervertebral foramen, those openings for the spinal nerves show up, like I showed you, here in the sacrum. And 5 fused vertebrae form the sacrum, but each one of these openings is a intervertebral foramen. Oops, let me go back. Each one of these openings is the opening for an intervertebral foramen, and a spinal nerve will be going into the towards the spinal column, towards the spinal cord through here and through here. And these nerves are mixed. That means that you'll have one part coming in and another part coming out. They'll be running side by side. One's a motor nerve and one is a sensory nerve. You'll have sensory and motor. You'll have sensory and motor. One going in, one coming out. And they're paired all the way down through here. Okay. But they have to get into the spinal column somehow. And so they come in through these intervertebral foramens. Now, here's where the foramens are actually, formed as an opening. In the rest of the vertebrae, in the spinal column made up the individual vertebrae, it's the nesting of the vertebrae that form those openings. Okay. And on the back side, we can still see the intervertebral foramens here. And we see a structure known as the spinous process. Now, the spinous process is a bulge coming out of the top, or coming out of the dorsal surface of the vertebrae. It's a point of attachment for large muscles of the back, and it's a landmark because it sticks straight out from each vertebrae. As you can imagine, it's a great place to anchor muscles on. So every vertebrae, except for the first 2 or so, are going to have a spinous process. It's a classic landmark to identify. So here we see a lumbar vertebrae set. This lumbar vertebrae, this particular model shows you a number of processes coming off of each one of these vertebrae. First of all, it tells us it's lumbar vertebrae. The first thing you see here is the spinous process. Now, to give you some perspective on this, if we were looking at this straight down, if we were looking at it like this, so we were looking at this bone, so we're looking at it flat, we would see a process stick out like this and like this. This one that's sticking straight up is the spinous process. On the side, these 2 here are called the transverse process. This is the body, as is this, as we're looking straight down upon it. And there's an opening right here for the spinal cord to go through. Now, let's clear that. Hopefully I didn't confuse you. There's the spinous process there. One of the 2 transverse processes there and there. They stick out to the sides. They're also a place of muscle attachment. There's the body of the vertebrae. Compact bone over top of spongy bone. Very strong and flexible structure. There's our spinal cord looking down. Our spinal cord is tucked in there and it runs down through what we call the vertebral foramen. So our spinal cord would be running down to about the level of thoracic 12, lumbar 1. Maybe it's about the size, about as big as your finger at this point, and through this own protected canal, called the through the vertebral foramen. And the nerves, this is a nerve here on the side, coming in through the intervertebral foramens that form as these vertebrae come together. Okay. There's an intervertebral disc, and it has some problems. The intervertebral disc, of course, is our shock absorber. When we walk or move, the shock of motion is brought up our legs and is transferred at the pelvic girdle at our hips. It's transferred in the front to the pubic symphysis, and the pubic symphysis absorbs the shock. It's a pad of cartilage in the front, and on the posterior surface, it is transferred at the sacroiliac joint into the sacrum, which shoots it straight up the spinal cord, up the spinal column, and then all of these intervertebral discs are going to absorb the shock of motion so that we aren't even aware of it. It shouldn't hurt to move. Sometimes it does, but it shouldn't hurt to move because the way that the shock of motion is spread throughout all of our vertebrae in here. So up and down, the movement up and down our legs, up and down our backbone, shouldn't hurt at all. There's one of our spinal nerves coming in from what looks like the left side. And this is a prolapsed disc. Sometimes these discs can't take, are abused. Sometimes they're injured and they will blow out. As they say, if someone says they've blown a disc or they've ruptured a disc, the pressure on that disc, for whatever reason, has caused it to fail. And it has bulged out, and it is supposed to be extraordinarily painful. And in many times, the repair for that is to take the disc out and fuse the vertebrae together so that there is, you lose some flexibility, but you get rid of all the pain. Now, make sure I covered everything there. Now, this is a thoracic vertebrae, looking at it from the side. This is, here we can see there's the body of the vertebrae that we were looking at. If we're looking at it straight down, it would be, round shape, but here we're looking at it from the side. There's the body. This is one of the transverse processes sticking out on the side coming towards us. There's one on the opposite side. They're like the wings of the vertebrae. Again, they're the points of attachment for muscles. And coming out below that, this structure is the spinous process. This is what we see sticking out on the back side of the vertebrae, of the spinal column. This straight process going straight out on the dorsal side. Now this structure here, this flat area, is what's called the superior articular process. Now, if you have a superior anything, you're going to have an inferior. And this is called superior because its surface faces upward. The surface here goes upward. The surface faces, superior means above. So the surface faces above. Now, if you have a superior anything, you're going to have an inferior, and you do. There's an inferior articular process that will nest on top of the superior surface. Let me clear this and I'll show you now. So there's the superior articular surface. And there is the inferior articular surface of this same vertebrae. Now, this one doesn't nest on top of that, But the vertebrae directly in front of this will. The inferior surface of this vertebrae right here will sit on top of a superior surface of the vertebrae below it. And the inferior surface of the vertebrae in front of this will nest on top of this one. Let me go back a couple slides and show you what I'm talking about. Now notice here, these vertebrae here that you see. Now, right here, you've got this nesting going on right here. Now, the surface that you see right there on this vertebrae, this surface here, that's the inferior surface because it presents itself down. It's facing down. The surface going up like this one or like this one here is the superior surface. And so what will happen is that the superior surface will have another okay, so we have a vertebrae like this, and we have a vertebrae like this. And this is the inferior surface here, and this is the superior surface here, and the space in between becomes the intervertebral foramen. That's what these things are here. They're formed by the nesting of the bottom surface and the top surface, and the cavity in between is the intervertebral foramen. Get rid of all this for us. Now let's go back to where we were. Okay, so this is our thoracic vertebrae. There's the body, there's the transverse process, there's the spinous process, there's the superior articular surface, and you're going to have an inferior surface sitting on top of that. Your inferior surface is going to be sitting right here at this spot. There's the superior surface. And the superior surface is facing upward, and there's your inferior surface, and your inferior surface will be sitting right there, and the gap that forms here, and there's another gap that forms here, because you're going to have another one right here. You're going to keep forming these gaps, and those gaps are the intervertebral foramen. Okay, I probably got you good and confused in that, and that's okay. Just go ahead. All you really need to remember is that the intervertebral foramens are how the spinal nerves enter the spinal cord. If we were on the ground, it would make a lot more sense. I could stick, I'd get the skeleton out and we would stick the structures through there and you'd see it better. But all you really need to know is that the intervertebral foramen, which is really at that location there, we call it the inferior notch. It's a notch now, but when the bones nest together, it forms that foramen for the spinal nerve to come through. Okay, I'm going to stop talking about that. I beat that to the ground. Okay. There's one of the facets for the ribs, the articular facet for the rib. The thoracic vertebrae have these. They're very hard to spot They're very hard to see, which is why it's very hard to distinguish which one is which between thoracic and cervical and thoracic and lumbar. And it's practically impossible to tell which one is which within the thoracic. Can you tell me the difference between thoracic 7 and thoracic 8, or 9 and 10, or lumbar 1 and lumbar 2? You know, they're very, very hard to tell the difference in. So as long as you know the clusters, the groupings, that's fine. There's another rib facet there, because you're going to come in and you got these 12 pairs of ribs. I got to come in and across it. Now here we see, looking straight down onto another thoracic vertebrae, you can see the body of the vertebrae. Here we see the vertebral foramen, where the spinal cord goes through. Here we see the spinous process. And we see the two transverse processes, one there and one on the other side. Spinous process sticks straight up and out. The transverse processes stick out from side to side. The vertebral foramen is the passageway for the spinal cord. The body of the vertebrae is where the intervertebral disc is going to set to function as a shock absorber. Okay. And there is the superior articular surface, where the vertebrae in front of this, or above this, I should say, is going to rest, forming the notch for the passageway of the spinal nerves. Okay. And the outer coating of the bone is called the lamina, and this area around the vertebral foramen is called the pedicle. Okay, now the two vertebrae that are very, very important to us: cervical vertebrae 1 and 2. 1 and 2 are different from all other vertebrae. Doesn't matter, whether they're cervical or lumbar or thoracic or sacral or even coccyx. They're different from all the rest. 1 and 2 are critical to us because 1 holds the skull upright, and number 2 allows the skull to turn, to rotate, to pivot around its axis. In fact, that's the name of cervical vertebrae number 2, the axis. So here we have 1 and 2. Number 1 is called the atlas, and it has the fossas, the flat areas on its surface that allow the occipital condyles to articulate. Those large processes that bulge outward there on either side of the vertebral foramen, they articulate on these fossas on the atlas. The atlas is designed to hold the skull upright. Now the axis allows the skull to turn, to pivot. There are some very large muscles that attach to the mastoid process that can pull in opposite directions and allow us to turn our head to the left or to the right. And this structure on the axis, called the dens, is like an axle. And since the skull sits on the atlas and the atlas sits on the axis, when those muscles pull on the skull will rotate around the axis on that axle called the dens that sticks up. Okay. So here we see C1 and C2. We're looking at right now is C1, the atlas. And if you look carefully, you can see the occipital condyles, like there's one right there as we go around. Let's see if I can get this to stop for me. Okay, right here is one of the occipital condyles resting on a fossa on the atlas. Let's see if I can get it to go around and over here on the other side. Oops, let me go back. Right let me. Back one. There we go. Now, so you can see where the condyles come down and rest on C1, cervical vertebrae 1, also known as the atlas. Now here is C2, the axis. And you can see the dens projecting upward here in the front. This is that bulge that sticks up. It's called the dens or the odontoid process. And pulling on the mastoid process of the skull by these muscles, these large muscles that we have attached there, will cause the head to rotate in opposite directions around the axis, around that particular process sticking up there. That's what gives us the ability to turn our head left and right. So C1 and C2 are shaped like no other vertebrae that we have. This is the atlas. And here are these fossa, here and here. I was telling you about there and there are where the occipital condyles are going to rest in here. Now you notice there is no spinous process in here, and the vertebral foramen is very large because we have a very large spinal cord coming up at this point. So it is totally different in the shape of any other vertebrae. There's no other vertebrae with the same shape as the atlas. Transverse foramen, that's something we haven't seen before, is a transverse foramen. And here we see C2. This is the axis. And there's the dens, or the what we also call the odontoid process. That sticks upward in the anterior position on the axis, and that structure functions like an axle to allow our skull to rotate, to turn left and right. Another view of, oops. In another view, there's there is the dens. And again, it doesn't have any, it is not at all similar than any other vertebrae. No other vertebrae has a dens or any kind of process like this sticking up. And so while we have the beginnings of a spinous process down here, I would stop pressing my button. No other structure has this like we have right here. So we have a very distinctive shape of C1 and C2. So you should be able to identify C1 and C2. So, okay. And that is the axial skeleton. So it's on here. Are there any questions? I know you have a lab test you want to look at. So are there any questions on any of this? Okay, I'm going to get you out, and I will see you in lecture on Wednesday. Or we'll meet on Zoom land on Wednesday. So.